पुराने जमाने में साधु महाराज बैठते थे तपस्या पे, ठीक है, वो 20-20 साल तपस्या करके निकालते थे जस्ट टू अचीव दैट वन सिंगल आशीर्वाद. Very stupid person, but the thing is what happened was that they gave us in the instrument wala, they gave us something.
Hello everyone. As soon as you might have clicked this video, I'm sure you're all excited for the guest we have today on our podcast. We have none other than Dr. Anuj Pacchel. As you all know, you must have subscribed him in his second year from GMC Nagpur, and today he is an intern and surely he is achieving great heights with respect to his channel as well as with respect to the academics and other pursuits of the life. Welcome Anuj to the channel, and we are really delighted to share your journey on Knya as well as to share with our viewers what a day in your life goes like.
First of all, thank you so much, Akshat. I'm a huge fan of your work personally, as well as the work of Kanya Med that has been providing so many doctors and so many people associated with healthcare with such good pair of clothing and, comfortable workplace clothes. So I'm really happy and very delighted to be here. And you're my senior. You've secured such a good rank in your NEET PG, and I have a lot to learn from you as well as a lot to learn from the creators behind this amazing brand. So amazing. Let's do this.
Great, Anuj. I think that's this is the quality that everyone loves about you, that you are very humble, and those words surely reflect the same. So I think let's begin with the podcast, and I think viewers are also noticing this, but that heart logo on your scrubs look amazing, right? So now,
thank you, yaar. Same. I feel the same.
Right. So let's start with the podcast and put our hearts into it. So the first question, which obviously which viewers would like to know is that how your internship is going on, and I think you have around a couple of months since you have joined your internship. So how is it treating you?
Yeah, so it's been 3 months almost. I mean, exactly, it's been 3 months,
yeah.
And so far it has been a huge learning experience. What my perception of different subjects was after reading the book has been altered by quite a lot. I always used to feel, okay, medicine is wow, it's such an amazing subject. I will always like to be a person who is going to be in medicine. But after attending the postings and everything, I feel like my inclination is towards the surgical sides more. So of course, internship is a place where you get to experiment a lot. You get to make a lot of mistakes and learn from them a lot. So surely I've made a lot of mistakes. I've learned a lot of different procedures and things which we just used to read in books. So I think that's the best part of an internship. And when you have a good setup where a lot of different cases are being coming, you learn a lot, especially if you have that learning mindset. ऐसा नहीं कि मैं सिर्फ काम करने जा रहा हूँ. You go with a mindset that I want to learn, I want to see the cases, I want to learn from them, and that way my internship has been going superb so far. So yes, to answer that question, I really love it, internship much more than I love final year.
Right. I think that's amazing that internship is the phase where the brand chooses you irrespective of whether you like or not. That's the way it's designed. So I think that's great that you are going well in the journey so far. So what lessons have you learned along the way since you started making YouTube videos? I think you also made some in a very initial years of MBBS, and now right now when I guess you capture the entire audience of medical school. So how's the journey? What's the skill set that is required with respect to you? Because the main thing is to balance. Obviously there are skill set required for making videos, but the important thing is consistency. So what would be your message to the viewers to balance life in medical school?
Yeah, so to answer your question, I've learned a lot of things while, and during this journey from my second year of MBS. First of all, I've learned that you should definitely follow your passions, whichever you have since your childhood. For example, I was very fond of making videos, and that's what translated into this channel. So I used to make videos earlier back when I was in class 7th or 8th. And now currently as an MBBS student and intern, the same thing is happening. So follow your passions. Don't let it go after 11th and 12th. And secondly, I would like to say that consistency is very important, like you said. With respect to anything, I think Rohan Khandelwal sir says this line repeatedly in his lectures that जो spikes और troughs है उसमें काम नहीं जमेगा, तुम्हें consistently एक wave pool create करना पड़ेगा, तभी तुम आगे बढ़ पाओगे. So I think that's the case scenario with me, that I remained consistent, and that is the reason that I was able to achieve all the different feats. So just stay consistent, थोड़े steps करो, but make sure that you do it every day.
Right. So as you said about the spikes and troughs, so have you ever felt burnout in MBBS or wondered if what could your life have been if you selected a less difficult course? And obviously, since you were so much into video making, right, like you said, from your childhood days, So maybe if you have chosen any alternate course, you can also pursue this as a full time. Whereas in medical, I don't think someone can pursue this full time unless and until, they are very strongly adherent to it. So did you ever felt this particular, imbalance?
Yeah, definitely. I did feel it. Especially, in my final year, I was extremely burnt out because यार पढ़ाई बहुत होती है, as you know. And उसके साथ साथ हमारी बैच को next का बहुत डर लग रहा था उस समय. So we
Right.
were very afraid that next is going to happen from our batch. So the stress of that next PG and this thing, video making and final year attending postings and all of that. So it definitely piled up really quickly. And I did not realize this, but the initial signs and symptoms earliest started in third year itself. When after the lockdown lifted, everybody was going into colleges. So since third year was really light, तीन ही subject है, तो कुछ लगा नहीं. Final
Right.
year में जब एकदम से सब कुछ आ गया, then it actually hit me. So I had to take breaks and travel, and that really helped me clear my mind. Of course, I did not miss any upload on any Sunday, even I was on a break. So I think that's what you should learn, that consistency even on if you're on a break. Try to back up में कुछ बना के रखो so that you can post it, especially if you are an upcoming content creator. So yes, burnout was real, definitely, and I think that it's very very common, especially in medical professionals, even in students. Us doctors, we face quite a lot of burnout because the last person that we pay the health part जिसका हम ध्यान रखते हैं, that is ourselves. So हम सब लोग को बोलते हैं अच्छा तुम exercise करो, sugar मत खाओ, and then we are at doing a night duty, coca cola पीते पीते निकाल रहे. So that is how it is, but it's part of the job. And I definitely feel that if I would have chosen a different field, it would really not be into filmmaking. It would be some sort of an educational thing only, like biotech or something like a BSc. But like I from the start only felt my passion towards becoming a doctor. That was and has been my dream ever since I was a child. So
Right.
maybe I would have not faced burnout, but I still I'm very lucky and happy to be here where I am.
Right. I think it's again connecting the dots and wherever the journey takes you, and it's very important that you enjoy whatever you do, irrespective of malab, there will be phases of burnout, but then there will be also phases of reward, which you definitely would have experienced the same. So now, since we are talking about medical student and how burnout, thoda negative side pe we are talking about things, but there are also some finest aspect of being a medical student. What do you like the best about attending medical school?
With respect to college, I would say the best part is actually learning about the diseases and things, which is very, very, you don't learn about diseases in any other course. Okay, the only place where you're going to learn about diseases is the medical field. And I think the best part is just getting to understand a particular disease, knowing how it works, and then actually seeing it and being able to connect the dots and find out कि अच्छा इससे ऐसे हुआ है, तो he probably might be suffering from this, and then actually the diagnosis happening. So I think that's one of the best parts, that you get to learn so much, which is probably present nowhere. And secondly, I would say the friends that you meet along the way are the other aspect. Like if you leave academics other ways, the social aspect may, since you are becoming a doctor, your entire conversation is like a medico itself. So if you talk with other medicos, you instantly become friends. And
Right.
I think that every doctor who is watching this can relate to this, that the people who are not enrolled in medical college, it's a little difficult to talk to them with, because we just say things very casually that are not so casual for the other people.
Right.
So I think that has been the best thing, that making friends who are with your own status. And I was lucky enough to find good friends that have stayed with me since the last 4 years. So
Right.
yeah, that's been it.
Right. So I think this is really some very, fine aspect that you mentioned, because since medical students, devote their 80% of time in medical school related stuff only. So the bonding also becomes very nice. With respect to other circle, I don't think that such senior junior interaction, or, that much of time you get with other person. So I think that's really one thing which helps us, to endure the entire journey. So now, all the NEET UG candidates watching this, now, we recently know that NEET entrance is getting more tough and the cutoff is rising. So what would be your one piece of advice for all those candidates who are aspiring to be a doctor?
Yeah, great point. So I would like to have a correction over there. The NEET exam is not getting tougher. It's getting
Right.
easier and easier day by day.
Right.
And the fact is that since it's getting easier, a lot of the people are getting great ranks. Plus, students are studying more than ever. Matlab in our times we didn't used to study this much like crazy. Okay, nowadays people are getting 720, and matlab I think above 700 there are like 250 people this year.
Right,
So
right,
that was in our entire, before 2018, nobody scored above 700 also. 685 was the highest in my time in 2018. So I
right.
think that if you're a NEET UG aspirant, if you are a fresher, if you are still in 11th and 12th, जस्ट अपना 100% दे दो. आई ऑलवेज से कि अपने इंडिया का कल्चर ऐसा रहा है कि पुराने जमाने में साधु महाराज बैठते थे तपस्या पे, ठीक है, वो 20-20 साल तपस्या करके निकालते थे जस्ट टू अचीव दैट वन सिंगल आशीर्वाद, ठीक है, भगवान से. सो यू हैव टू मेक दिस योर तपस्या. यू हैव टू गिव अप एवरीथिंग. यू हैव टू गिव अप गोइंग आउटसाइड. यू हैव टू गिव अप फ्रेंड्स. यू हैव टू गिव अप वाचिंग टीवीज, मूवीज, स्क्रॉलिंग रील्स, शॉर्ट्स, वाचिंग वीडियोस ऑन यूट्यूब. गिव अप एवरीथिंग. तुम जब तक वो तपस्या में नहीं जाओगे तब तक तुम्हें आशीर्वाद नहीं मिलेगा. आई थिंक दैट्स द इजीएस्ट वे टू रिलेट टू इट. एंड लोग बोलते हैं बहुत इंपॉसिबल. ऐसा नहीं यार, साधु महाराज पुराने जमाने में करते थे, बहुत बार करते थे. एवरी बुक दैट इज रिटन इन द इंडियन मैथोलॉजी सेज दैट. So I
Right.
think you have to enter into that tapasya mode. There is no shortcut to it. If anybody promises to you that हाँ तुम्हारा 6 महीने में हो जाएगा complete, they are probably trying to sell you a course. So don't buy it and just focus on your own abilities. Learn every day consistently and tapasya mein lag jao. That is what I would say. And if you're a repeater, it is even difficult for you. It is even more difficult for you because now you are again facing the fresher competition along with the dropper.
Right.
So you have to work hard, twice as hard as a normal regular fresher would. So, but don't lose hope. It's definitely possible because the syllabus of NEET is less than first year MBBS, so you can definitely pull it off. But it does take effort. So, all the best to everybody who is watching this.
Right, right, right. Even nowadays what we friends discuss is कि अगर कोई हमको आंसर की भी बता दे कि this is the answer of the NEET paper, still we would mark 1 or 2 OMR wrong. But still students are achieving 720 out of 720, so that is such a tremendous task. So right, so now like you talked about tapasya. So there's also a tapasya that medical school wants you to go through. That is reading standard books, because reading standard textbooks is something which is a very patient task कि आपको उसको धीरे धीरे करके करना है. Then you will only understand the depth of that particular textbook. So now what would be your advice? Because nowadays, since you were also worried about next batches are surely worried about next. So what is the advantage of reading standard textbooks even now, and how they should approach it?
So I'll just tell you one thing, that I personally believe that standard books are not 100% compulsory to everybody.
Right.
I personally believe that you should read a book. I mean, these are not my words. This is the HOD of medicine who told me this. He said that read the book from which you can understand and you can reciprocate and you can, totally write the answers. You just read that book. It doesn't have to be Harrison. It doesn't have to be any other book. Read a book जिसमें तुम्हें समझे और तुम इसे याद रखो. I think that's the core concept, ठीक है? Because even if you're reading a standard book, if you're not understanding anything and if you're not able to learn anything, there is no point of reading it, right? If you are able to understand it and memorize it, very good, amazing, you do read it. But it's not compulsory for everybody. The things which I really want to convey to people is that even though it might not be compulsory for you, try to read the most important topics from that. Topics which a doctor should know. I'll give you an example. If you're reading medicine, you should know diabetic ketoacidosis. You should know acid-base disorders. You should know something like respiratory failure or different types of diseases, COPD and all of that. So these are some special topics which you should absolutely know. But it's not like compulsory ki 100% you have to read the entire book cover to cover. I have personally myself have read almost all the standard books up till the final year of MBBS. In final year, I think I did not read for medicine. Apart from that, all the books I read were standard books, and they really helped me, get the concept in my mind. So most of the times in other books, you will find that they are focused mainly on the question and answer part, whereas the standard books are focused much more on the treating the patient part. मतलब they will teach you how to treat the patient, and the others will teach you how to write the paper. So एक वो थोड़ा सा difference आ जाता है उसमें, and I think that if you can, you should go ahead with it. The only thing that I would say is that supplement that standard book with any set of videos that you can find on the internet, because understanding can be a bit difficult. So any subscription which you have, you can use it. And if you watch the videos first, the reading books part will become very easy for you. I have personally experienced that with surgery, medicine, and also pathology. So that would be my advice. And minimum, the only standard book that you should be reading, agar kuch nahi padh rahe ho, that is Robbins, because it forms the crux of almost every subject. Sub subject mein pathology aati hai, Robbins padh lo, it will be very crisp and clear to you.
Right. So I think this is a very great opinion, and also the way standard textbooks, make it is a sort of a story. You are not learning something just for the sake of learning, but you are learning how the patient will approach you. So I think that becomes very interesting when you start reading textbook, and it expands your horizons. So now I think we had enough of the informative session for all the juniors as well as someone who is now in the medical school. So now let's have some fun rapid fire that the audience would like to surely know. So, any biggest Viva blunder that you did in your MBBS?
Biggest Viva blunders. Yeah, there was one. So I think I was in final year, and there was this medicine viva which was going on. So it was for our part completion test. So after our postings, and I'm a very stupid person, but the thing is, what happened was that they gave us in the instrument wala, they gave us something, and मुझे बोला क्या है? It was an intracath. ठीक है, everybody knew it. उस पर लिखा था intracath. एंड मैं एकदम कंफ्यूज में पड़ा, ये लंबर पंचर नीडल है कि इंटरकैथ है, लंबर है कि इंटरकैथ है, बिकॉज यार फाइनल ईयर में आई हैड नेवर सीन एन इंटरकैथ, आई हैड नेवर पुट एन इंटरकैथ, नीदर डिड आई डू एलपी, सो आई वाज नॉट अवेयर, बट मैं बहुत कंफ्यूज हो गया, मैं बोलूं कि नहीं बोलूं, फिर मैंने बहुत ध्यान से पढ़ा इंटरकैथ है, सर इंटरकैथ है, मतलब आई जस्ट नैरोली एस्केप, अगर मैं बोला था तो मुझे फेल कर दिया होता वहीं पे, सो ये एक हुआ था मेरे से.
So I think this is again because of getting so much knowledge, but उसको फिर लगा भी देते हैं हम इतना सारा कि ये इतनी बड़ी चीज भी हो सकती है, पर कई बार बहुत छोटी छोटी चीजें होती हैं जो which are kept in the viva or anyway. So I think you
Exactly, and the practical part of it is like you don't get to experience the practical part unless and until you are an intern. Before internship, तुमने कभी RT नहीं डाला है, never did Foley's, never did intracath, so don't know anything. You never did central line. So if anybody gives you ये क्या है, how will you know? You won't know. So बस वो images देख के नहीं आने वाला. So एक था यार ये.
Right. I think this is a nightmare for all the student. Viva में से जब उठाने को बोलते हैं. So I think you recently visited Paris. So any dream trip that you have which is still on the cards and you would like to fulfill?
Yeah, so I actually had two places that I really want to visit. First one of them is New York. So I have watched all the Spider-Man movies, and I mean almost every superhero movie happens in New York. So I think that subconsciously, created something like मुझे New York बहुत पसंद in my mind, and I'm a huge fan of Casey Neistat. I love his vlogs. So he lives in New York. He made daily vlogs back in the day in 2016, 2015. So I think those two factors made New York my dream city. I am going to be going to New York next year. And the other thing that I'm planning to do is go to Bali, because that is a place full connected to nature. So hopefully I'm going to Bali next month. So dono bhi cover hone wala within 1 year. So very happy with respect to that.
Right. I guess amazing. This is surely the way you should take breaks whenever possible. So in entire MBBS, if you had the liberty, you are the NMC chairman, कि एक subject हटा दो MBBS से. If you had that liberty, which subject would you like to think कि exist नहीं करना चाहिए? Maybe मतलब it's not that it's not important, but it's very frustrating for you to learn it.
See, देख मेरी उस सब्जेक्ट की पोस्टिंग हुई नहीं है. Right. So I would really like to restrict my answer over here, because if my seniors see that subject and if I say that, I won't get the completion in internship. So it's not medicine, surgery, pediatrics or forensic medicine. It's a subject in third year, and it's a subject which is very difficult for a lot of students. And इसकी काफी बड़ी सी book भी आती है. So that's all I'm gonna say.
I think you don't want to go in your CHC PHC. Okay, that's great. So I think viewers must have understood what he's up to right now, but let's not disclose it. So like you said that you want to go towards the surgical branch, but any still branch of choice maybe in surgical, would you like to do MCH या अभी इतना सोचा नहीं है, अभी बस करना है जो भी?
नहीं यार, I actually genuinely feel कि वो सब बाद में decide करूँगा, but अभी तो I'm only like कि the only thing which is satisfying me is seeing that the patient is getting cured. And I was in the ICU and medicine. I did a few postings as well, but the only problem that I was noticing was that the patients come to medicine in such a late phase. Right. That it's really difficult to reverse the disease process. It's not like medicine does not work. If you catch the disease earlier, medicine works like a charm. It will cure the disease, right? But in India, it's so rare to see people, actually presenting with good symptoms. For example, MS, until they are not gasping, they won't come to you. And then it's too late for you to do medical management. So a surgeon has to interfere. So that's the thing that I feel like in India, early symptoms, early warning signs का उतना scene नहीं है, diagnosis भी late होता है. So that one thing, and surgery में I used to see that our ward used to just get fill up in the day, and within 1 week every patient was discharged. So that the happy feeling which I got after seeing that the patients are actually getting better after surgery, they are going away, that was the best feeling. So for that reason, and also I feel very excited. I scrubbed in for a thyroidectomy with one of our lecturers, and they were awesome. They let me do a few things as well. So I think that surely sparked the interest in me. So general surgery, I'm thinking of going in that direction, but it's still not confirmed. But that has been the highest inclination up to this point.
Right. I guess amazing. Your entire internship will surely, help you more in deciding that particular thing. And so last question, again, a rapid fire. One single worst thing about medical college.
One single worst thing. If you have suffered from it, it would probably be ragging. अगर तुम्हारे साथ बहुत खराब ragging हुई है, it would probably be ragging. Otherwise, I don't think there is any single worst thing about medical college except for ragging. मतलब, if you have not suffered it, then for you medical college has been good. But I know people who have went through severe ragging, and that caused them to have some serious mental up and down because of that. So that is bad thing. That should not happen.
Right. I think you beautifully summed the entire journey, right from the questions related to the informative part as well as the rapid fire. So Anuj, it was a great pleasure to have the interview with you, and I think we are almost at the end of it. So some conclusive words which you would like to share with the audience.
Yeah, first of all, thank you so much, guys, for watching till the end. I'm really happy that you find this interview interesting. It was one of the best interviews I'd ever done because the senior Akshat sir is so great at conducting the interview, and he's just great at everything basically. So thank you so much for watching. And Kanya Med is, I would like to say something like, I used to be a fan of them since I was in final year, but I never got around to buying anything because I never needed it. But an internship, since I have been going to the hospital every day and I have to work 12 hours, 24 hours, sometimes even more during admission days. So what happens is that you really need a comfortable wear, a comfortable piece of clothing which you can rely on, which has enough pockets to carry so much samples and everything. So at that point, the scrubs which the company Kanya Med is making comes really handy. The quality is great, the fabric is great, and they are not ऐसा कुछ paid नहीं है, मैं खुद से बोल रहा हूँ ये. So I'm really happy that you guys are partnering up, and I'm so happy to be part of this community of doctors who are with you guys. And the shorts or reels बहुत सही बनाते हो. Keep it up.
Right. I think thank you so much, Anuj, for the entire, appreciation that you have been showing to us. And we really wish forward to, continue the journey. Next year, once you visit New York, we will again come here. We will talk about your surgical residency when it starts, hopefully surgical, and then also about the other stuff of life. So I think this was a great experience, and viewers should have surely enjoyed it. And if you guys have any other queries, feel free to comment below. And everything about Anuj's channels, right from Insta to YouTube. You can surely DM him, and he replies on Sundays only or Fridays. I think you have a day set for that also, right?
Yeah, but that was the case earlier.
Right.
Yeah.
Right. I remembered when first time we communicated, I got your message, I guess, on Friday, and you said that I replied on your Friday. So I think that's really very micro procedure. Like, हम कोई सोचते कि चलो अभी मैसेज देख लेते हैं, but then that's why it becomes very difficult for you to balance things. But अगर आप छोटी छोटी चीजों को भी sort out करते हो, तो it gets really good. So I think thank you so much, Anuj, and it was so nice to have you guys.
Thank you so much, bro. Same. Thank you so much.